Hi, I'm Dr. Rajani. Thanks for joining me today. An exciting topic everyone's going to love, the new FDA approval of Restylane's Kysse product. Kysse, what's Kysse? Well, as you can imagine, Kysse is a new lip filler approved this month by the FDA in the United States for lip filler to last up to a year. We're going to talk a little bit about longevity today. Going to talk a little bit about the technique. What makes this product different? Should you consider getting it? What about the product? What about the depth that maybe we know about from a bit of the rheology of the product, how it works? It's going to change our injection technique. If you're getting lip fillers, should you go out and get this? Is it going to last you longer? What are the things you're going to like? What are some of the downfalls to it? Lip fillers, we know it's a hot topic. Natural feeling, natural looking, but also creating projections and beauty for some. Is it going to plump as much? Does it draw water? What about the vermilion border? And then at the end of the video, I'm going to show you injection techniques that you can use with this product and how you can maximize results, patient satisfaction, and safety. Because remember, and for all you home gamers out there, it's not just about the filler and the product, although that's so key, because if a product has a high incidence of side effects, no matter how you put it in or how good you are, you're going to have a certain percentage of problems. And one thing about this product that I'll talk to you about is it's been used in other countries. I'm Canadian, of course, I've used it in Canada, and that it has been up there for a while, but also in Europe. So there's a lot of data, and it's a relative of products we're using already, namely Restylane Define, which is a #1 product I put in lips in my clinic. Although it has structured support that's a little much for the lip, especially the younger generation like it, I think they'll all move towards Kysse. Why? Stay tuned for this video. We're going to go through it. I'm going to show you the injections. And remember, we have all kinds of good videos coming up. One of them that you guys asked for is on the dermal roller. So we'll be covering the dermal roller and a lot of other do-it-yourself treatments for skincare, not injections. It's something to leave to the professionals. We'll go through why now. In 3 seconds, we're going to start this video. So Restylane Kysse, what is it? We all know the Restylane line of fillers, and people still come in and say, I want my Restylane. Now there's many types of Restylane. Lift, Restylane L, which is the original one, plus a bit of lidocaine, Refine, Define, Silk. So there's different ones in different technologies. Not to get into too much detail here, but Kysse is within the Refine, Define, the stretchable family that integrates with the tissue. Why it's so unique, I talked a little bit about the planes of injection. If you think about Define, strong, to me, it has a lot of support. The G prime on the graph, if you look, I believe Define in my hands and in many of my colleagues' hands would guesstimate that the G prime's higher than it measures. And that's why I use it on jawlines. I use it for chin projection. And of course, really hard to lift the edge of the mouth. And that's why Define does such a great job, because it has a lot of G prime, doesn't draw water in. So Restylane Kysse is going to lie between Refine, which is smaller. Think of it more stretchy, smaller molecule, more lightweight work, okay, but flexible. And Define, which is also flexible, doesn't draw water in, but think of it as more robust. In the middle, we have Restylane Kysse, and that's what makes it exciting. Integrating with the tissues, flexible, but you don't have to deal with the big oomph that maybe Define would give. And a lot of times we look at, think of the maybe a little older patient, maybe my age plus, okay, and they don't want big structural lips. They don't want a very pointed GK point. They don't want a strong filter column. They just want some vertical lip lines gone. And if you get vertical lip lines, one of the quickest way, you grow one of these. You can have a mustache. It's kind of free, and if you can't get into your provider, just grow a mustache. You'll be able to get rid of your vertical lip lines without filler. It's the all natural way. We'll do a whole nother video on it. But that's the benefit of it. It's in between those two. So let's go into a little bit about the rheology, or a little more into how it's made, the cross-linking, the structure, and after that we'll go on and we'll watch some injections. So what about G prime? G prime is misunderstood by some, it's measured differently by others, so it's a bit of a moving target if you want the honest opinion. I've been following G prime now since the early 2000s when we had low G prime or very soft fillers we injected very differently that had nothing to do with hyaluronic acid like the most common we use now, namely collagen derivatives. In Canada, of course, we had Arteplast and Articol. So G prime, if for most people think of it, think about as power, the ability to maintain shape, the structure and support. The G prime of this product is in between what we talked about, define, which is higher G prime, and refine. And it is formed by a mesh process after the cross-linking. So the cross-linking of refine is 6, of KYSSE is 7, and of define is 8. But it's not just about the cross-linking, it's also the products are put through a strainer or a sieve, so you get molecule size. It's all very complex, but most important for the end user is it's the perfect combination of G prime structure and support, and also molecule size, longevity, and feeling natural. So those are part of what is going to make it so important for the lip. And of course, integration with tissue. It's another heated topic. There's going to be different opinions on it. Not every product integrates with the tissue, nor do you always want it to. The reason is sometimes we want lifting, structure, support, and we don't want the body to be able to see that product in smaller amounts within the tissue. We want it to remain as boluses, more structural, places where you can deal with that. Think of where people might get implants, and I know what you're going to say, Rajani, there are lip implants, and I know I worked around them, I filled around them, put them in. It was more common before lip fillers. I don't like any of it, but some people do, and some people went to permanent silicone, which is a whole nother topic I cover in my other videos. Suffice it to say, the amount of integration with the tissue or becoming one with the body is another key factor that separates lip, because it does integrate with the tissue, because it's stretchable. Also, theory, and this is all theory, there's no double-blind placebo-controlled trial to tell us this stuff. People are going to give you a lot of opinions. My opinion is if it integrates with the tissue and it has some stretchability, it feels soft, feels natural, does not draw a lot of water. Okay, sometimes you might, I see a lip and I want water. Where you go, okay, that's pillowy soft. It already has perfect projection, perfect ski jump. Maybe you've lined around the outside of the lip or the vermilion border with a product that has a lot of structure and support, and you want that, but you don't want water going in around that border. This will be a perfect product for that. And then you look at the lip body where it's plump, and you say, you know what, I wouldn't mind it if it was a little watery in the body of the lip, a little pillowy, a little hydrated looking. Now you can use a different tool for the body of the lip than the vermilion. We used to use collagen still when we had Restylane, the first hyaluronic acid in the United States. We would put the Restylane in the body and we still had collagen. We liked it, especially at the vermilion border, because it didn't bring water in. So it had a crisp, beautiful, not ducky border, but a hydrated, perfect, pillowy lip. And so you can mix products as well, because these products can be used in other areas. It's not like you need to only use your KYSSE in the lip and it doesn't work anywhere else. Just like Define. Define works really well for the nasolabial and the oral commissures and the jawline and chin projection, but we like it in the lip. I like it in the lip. Not for those faint of heart, not for those not wanting projection, structure, and support. They want a softer product. So you can see KYSSE seems to have that perfect balance. So lip filling technique. One of the things, now that you know a little bit about the product, where it comes from in terms of structure, support, integration with the tissues, that I think is going to be key, is that we can integrate the product with the tissue more so than Define and less than Refine, perfectly for the mucosal surface of the lip. We can get it, it's going to be more forgiving. So we can inject it in multiple different ways, particularly superficial. And this is certainly not an anatomy course. This would be a 1-hour lecture on it, but suffice it to say, the vessel that we concern ourselves with the lip is typically posterior or between the inner mucosa and the muscle. The lip is mainly made of muscle and a tiny bit of fat. But sometimes the lip sits aberrant, or we can call it aberrant, but just naturally where we don't expect it, which is a little more anterior. And that typically where I'm talking about is about 4% of the time, but it is a little more risky in those patients. Certainly you can grab a cannula. This product wasn't approved for cannula injections, but there's no reason you can't. 25 gauge cannula is a lot nicer. It will push through a 27, most 27s. 25 is still going to be better. With the cannula, you're in the body of the lip. But most importantly is that we can go superficial and deep. I did a video a while ago, maybe a few weeks ago, on the Russian lip tinting technique. A lot of people comment, the Russians commented on it. Of course, I've been to Russia. I've seen how they fill lips, work with Russians here. And a lot of Russians that have clinics have Russian patients. You see, the Russians go to the Russians. That's what happens, especially in New York and in the big cities. And you watch the technique. So a lot of them commented. You can go watch the comments. It was very nice in that video. Other people call it the pillar technique, the tenting technique, whatever floats your boat. Understand that technique's been around for 20 years. Don't be scared of it. We did it with collagen, because collagen we could inject superficial. It didn't last longer, and it was intradermal. So we did that pillar technique 20 years ago. Before we go on to the injections, remember, click the like button, helps us with the YouTube algorithm. Click subscribe, and when you do, you'll have an option for the bell. And if you click that bell, you'll be notified of all the upcoming videos and the latest and greatest to keep your skin and body beautiful, healthy, and vibrant. On to the injections. So if we look at the first video, this will be the traditional technique. This is where we're injecting the body of the lip. We're going to then follow with the vermilion border and the Cupid's bow. It's nice to start laterally and move inward. Everyone's going to have their own different technique, and it's totally fine. This is what makes us unique, and it's our artistry. But I start laterally and move inward because I want the lip to numb. It's more sensitive as we go inward or medial. And so doing the Cupid's bow last allows the numbing in the product, and this numbing really actually works, because when we originally had numbing, even the old collagen came with numbing, and we could add some to it, but the numbing didn't really work much. And now if you get filler, a lot of my patients choose no topical, no injections for nerve blocks. It's kind of old school. There's no real need for it. A lip filler should take you 7 to 9 minutes to do, and so most people don't want to leave numb because of that. But because they get no other type of numbing, at the end of it, they'll say, wow, my lips are numb. Is it normal? Has something gone wrong? You say, no, it's the numbing in the product. Whereas before, the numbing wasn't good enough to do that. So this is the traditional technique. One caveat here, we always look at the lip in 3D. I can't fill a lip if I'm not thinking about the oral commissure, the projection from the lateral, so the lip, the nose, the rickets or E-line. So when you come in for a lip filler, guaranteed, nothing's guaranteed. Guaranteed if you come see me, I'm going to talk to you about your nose to your chin, the projection of the lip, and what might need to be done. Lip is not lip filler, it's lower face beautification. No one just needs a lip filler, and certainly they can get that, but there's likely most people are going to need something else fine-tuned. Certainly, we're seeing now the #1 demographic come to my channel here is 30 to 39. That's the average. So many are 20 to 29. Certainly, they just need lip filler. But after the age of 30, we're usually looking at other things as well. You don't have to do them on that visit, but if your provider talks to you about them, it's because that's what they're seeing, so digest it. The next technique that one can use is the lip tenting technique, the pillar technique, the Russian lip filling technique. Comment at the end, by the way, let me know, what do you call it? What do you perceive the Russian technique to be? It's a highly searched term as a Google keyword, so people must be looking it up. But this is where we're coming in at the vermilion, not really above in the white, because you're starting to get to where There's a columellar artery in the center that moves up, and again, it might not move up right at the philtrum column, it might start to move laterally. In fact, the facial artery coming up, sometimes the takeoff of the alar branch is with the labial artery. So there's all kinds of aberrancies. Some people are going to say, if you know your anatomy, you know comfort, or you know security. And I say the opposite. You know your anatomy to know enough that you don't know anything. But you need to know your anatomy. It's very, very important. But once you do, and you do enough cadaver dissections, you never depend on your anatomy because you see these aberrancies. So this is where you come in at the vermilion and you inject down through the mucosa. This is typically a more superficial injection, particularly because it's quite theoretical that it could be a little more dangerous because you could be there could be an anterior type of artery that supplies the lip here. And by doing these columns, a lot of times it takes a little less filler and you can do different things. A lot of times it's a combination between traditional and this technique. And then there comes filling the edge, and this is controversial. I do like to fill it because many people have a downward mouth, and of course we're doing toxin here, we're doing lip filler, and the lateral, we don't want to create the fish mouth or a wide mouth unless they have a wide masseter. But a lot of people don't want to add laterally, but remember, if you're losing lip volume in the center, people aren't going to first notice I'm losing center lip volume. They notice because it tapers at the edge, because 20% of a small amount, you're going to see more gone. So if you lose 20% at the edge, it's more noticeable than in the center to people. So dimensions and math, the beauty of math and the math of beauty is just so important. So Restylane Kysse, that should help understand a little more about it. I think it is going to change the way a lot of people inject. It's going to bring more attention, if you can believe it, to the lips. And of course, all our celebrities, all our TV hosts, all our anchors that we see now, you see them transform over a year, 2 or 3, and even the young ones, a lot of times it's lip filler. Let me know what your thoughts are. If you have any questions on Kysse, ask at the end here. We can do a whole nother video. Remember, I did a video on it probably a couple of years ago. I'll post a link to that. So I bring things up before they even get to this country, because I know a lot of people on this channel are forward thinking and they want to know everything before it even gets here. Thanks for joining me. Subscribe, enjoy these videos to keep your skin and body beautiful, healthy, and vibrant.